Hi, my name is Eva Steiner and this is my project Psychotherapists Around the Globe. I am interviewing the psychotherapists around the world and asking them the same 8 questions. I am wondering how mental health profession is in their country. Today we are going to... Thank you for taking this time for doing this interview with me. Before we start, can you tell me a little bit about yourself?
Thank you for having me, Eva. This is a great pleasure. So let me introduce myself. My name is Hind Lahmar. I am a clinical psychologist from Algeria, North Africa. I am also specialized in anxiety disorders and OCD.
Tell me a little bit about your culture. What is some holiday or tradition that your country celebrates? And if your country would be an emotion, what emotion would it be?
This is a very good question since we are going to celebrate a national holiday in 2 days. So most of our holidays are religious holidays. We are a Muslim country, so we celebrate Eid, Ramadan, we celebrate Murud. So there's many religious holidays that we do celebrate and some cultural ones here and there. And if my country was an emotion, it would probably be anger or sadness. I know it's a quite harsh emotion, but we struggled a lot with colonialism and terrorism. So this emotion fits us the best.
Can you tell me a little bit more about this anger or sadness?
As I've mentioned before, we are a North African country, and North Africa has been colonized by France for a very long time. And then after the colonialism, there were a lot of civil wars, a lot of terrorism. So this created a lot of conflict, a lot of anger, a lot of sadness in many Algerian individuals and many North Africans. So this is why I chose this exact emotion, since it seems like we as Algerians struggle a lot with emotional regulation.
And it's like anger towards the one that colonized you, or what is this anger about, or how the state is right now after the colonization?
Fortunately for us, like today, everything is going well. The colonialism ended almost a century ago, and the terrorism ended almost 2 decades ago. So everything is going well so far, but the anger is will towards the colonizers and towards ourselves as well, especially for going through it for so many years.
How did you become a psychotherapist in your country, and what is your therapeutic approach?
Psychotherapist is not a protected title in Algeria. For us to become clinical psychologists, we have to do 3 years, a bachelor's degree for 3 years and a master's degree for 2 years. So overall, it is a 5 years university course. And then we have to do a lot of trainings in multiple domains and then get supervision to become clinical psychologists.
And then you can work with people after you finish your master, or do you need some sort of specialization or praxis?
So we can start working with people right after our master's, but that depends on the specialty. So in my country, I did clinical psychology, but we have a lot of other specialties like social psychology, health psychology, cognitive behavioral therapy. We have educational psychology. We also have work psychology. So it depends on your specialty. But since I went with clinical psychology, I had the privilege to work right after graduation.
So basically, one of the specialties is also cognitive behavior therapy.
Yes. So you do study clinical psychology for 3 years. And then when you get to your master's, you have the choice to either complete your courses in clinical psychology or choose cognitive behavioral therapy. So in both cases, you are still a clinical psychologist, but with a specific specialty.
Okay, and psychotherapy, you said it's not a protective title, but is it like a profession there or not yet?
It is not a profession, but a lot of people can do extra training for 2 years to get the title of psychotherapist that is recognized internationally. So there's a lot of foundations, associations, a lot of schools that are specialized in teaching freshly graduates and clinical psychologists psychotherapy. So this training is around 150 hours, and it has supervision, it has everything that has to do with psychotherapy. And once you are done with that, you can use the psychotherapist title on an international basis.
And do you need to be a psychologist or clinical psychologist to enter this psychotherapy education, or can you be something else?
So this is very interesting. There is some criteria to do this course, this 2 years training. You either have to be a clinical psychologist or a psychiatrist.
How is regarding the law about psychology? law about psychotherapy?
Regarding the law, I'm pretty sure we follow a lot of European guidelines. All of our laws are the same as the European ones. There is the patient and therapist confidentiality. We cannot tell the parents of the patients what the patient said to us. It's exactly the same as in European countries, but we don't have any laws regarding the title of psychotherapist.
And how the psychological help is offered through public system, through public health system, or privately?
So this is very nice because we are fortunate enough to have hospitals and public clinics that offer free psychotherapy for a lot of people. And we have the private ones. So it's truly up to the individual to choose whether to go down the hospital route to get a free consultations, free sessions, or to go the private route to pay for the consultations.
The third question, how society looks upon psychotherapy or any psychological help?
During the years, this has changed immensely. Going back a few years ago, maybe around 10 years ago, psychologists were not viewed in a very good light. There was a lot of stigma around therapy, a lot of stigma around mental disorders. But with the rise of social media, of movies and series that include therapists, that include mental disorders, people have become more open to the idea of going to a therapist. So currently in 2024, there's still some stigma around mental health, but we are fortunate to have a lot of the newer generation that recognize therapy as something essential, as something that is needed.
And what is some mental health stigma that is still sticking around, or was some mental health stigma?
In our country, we have this term, it's called mehbul. Mehbul is like the term crazy. So a lot of people, when we talk about therapists, we talk about psychiatrists, they would say, oh, I'm not crazy. I can't visit a therapist or a psychiatrist. So this was the stigma around therapists and psychiatrists, that we only treat the term crazy. So we had to do a lot of awareness, a lot of work around these terms to change them and to make people realize that we deal with all sorts of issues. We don't deal with this exact term only, and that there are mental disorders. So it has been a very long route, and we are still on that route to change the perspective of people around these specific terms.
And you mentioned the difference between the youth, the younger generation, and I assume older generation. Can you tell me a little bit about this difference?
I can create a category of people around 35 and under. They are very open to the idea of visiting a psychologist or taking their kids to a psychologist or a psychiatrist. But people around 40 and up, they are still a bit close-minded about the idea of therapy. They don't essentially believe in it. They don't essentially believe that it is efficient, especially for mental disorders. So as I mentioned before, we live in a North African country. We live in a religious country. So a lot of people, whenever there is a mention of a mental disorder, they chalk it up to witchcraft. So there is still this exact stigma around it. And we find this with people that are 40 and up or 50 and up. But the newer generations, or maybe 35 and under, they are way more open to seeing a therapist, to acknowledging mental disorders as actual disorders.
What is your society teaching about child-parent relationship, and whether this value of society also influence how you design your interventions as a therapist?
A little fact, Algeria is the biggest country in Africa. So it is very, very, very diverse. Just the north, the south, the east, and the west, they have all different parenting style. So, and it is heavily dependent on specific Arab parenting style and specific European parenting style. So it's pretty much divided. You can find some parents that use gentle parenting, but they are few. They are very rare. And some parents that don't believe in gentle parenting. This will answer some of the questions that you have for later about the main issues that people come to therapy for, but it's mainly about the family systems and the parenting styles. So we pick interventions depending on the actual level of awareness of the parent. Some parents completely deny the mental health of their kids, so we have to use different interventions with them. And some others are very open and understanding, so it is easier for us to work with them.
how does society or the culture see the parent? Is like a parent's like equal to the child, or is like the child needs to respect or even obey the parent? What is the position of the parent in the society?
So if we have to generalize or talk about the majority, so the majority sees that the parent and the child are not equal. The child has to respect and obey and work along the lines of what the parents wants them to be. And this is something that is very common in North African countries, and it's something that a lot of people struggle with. But as I've mentioned before, the newer generation, the newer parents are changing this perspective. But overall, the general population still believes that kids should follow in their parents' footsteps. They should obey and respect their parents. And the gentle parenting approach would never be accepted by the general population of this country.
And if an adult client would come to you and say, I don't want to see my parents anymore, I want to cut contact, how would you approach as a therapist, and how would society look upon such a request?
So society would definitely look down upon such a request. They would definitely not accept this, but sometimes it is needed, especially if we see that the family system is abusive, especially if we see that the family could be a very big risk to the client. So this is where the interventions differ. Sometimes we can work around it, especially if the client is religious and they want to fix stuff up with their parents. They want to fix stuff up with their family. But sometimes some clients come with the mentality of the no contact. So it's truly up to the client. We have to respect the client's wishes. If they want to go no contacts with their family, we try to give them the tools to do so in the most or in the least riskiest way.
And can you tell me a little bit more about the role of a mother and role of the father in your culture?
These roles are very traditional roles. When we are talking about the role of a mother or a father, we're talking about the mother has to stay at home and be there for the husband, and the husband has to be the provider. But this is still overall generalized view of the majority of the people. But with the newer generation, it's definitely changing. With the newer generation, we are advocating for more dual income parents. We are advocating for more women to actually work and take care of the kids at the same time. But if we look at the older generation, this was not a thing before.
I want to understand, how do maybe older generation that comes to you see you as a young working woman?
So the older generation, as I've mentioned before, they're not very open to the idea of therapy. So it's very rare for us to see the older generation come to therapy. But we can see it with a specific category of the older generation, the ones that are heavily influenced by the European culture. So I am fortunate enough to live and work in the capital. And in the capital, there are more people that are aware about therapy. Whenever I get an older patient, it's usually, or a client, it's usually for their kids or for marriage issues. But they do look down upon young working people, but it is not a sex-related perspective, but it's more about an experience perspective.
And in general, how do they see psychologists in your society? Because in general, for example, doctors are often seen as authority, and then that type of relationship is established. Like, in what way do they see psychologists in your country?
In my country, a lot of people do not differ between a clinical psychologist and a doctor. So they call us doctors. And whenever we correct this view that we are not doctors, that we did not go to medical school, they still refer to us as doctors because it is easier for them to see us that way, especially that in my country, when we are dealing with clients, we wear the white blouse sometimes, especially if we work in a hospital. So it is easier for them to refer to us as that instead of referring to us with our actual titles.
What do they expect then from the therapy? So with a doctor, it's usually really quick. They give you medication and you are fixed, let's say. Do they expect quick fix from psychology, from psychotherapy?
So they definitely do expect that. They always come with the idea that I'm gonna do 3 sessions and then I'm fixed. And then we have to do a whole lot of psychoeducation. We have to talk to them about the need to do a lot of sessions weekly to get to their goals, to achieve their goals. And this is an idea that is most of the time accepted once they actually learn that therapy or a session is around 45 minutes, is a weekly kind of thing. It is usually accepted, but not by all. A lot of people are still searching for that quick fix, and they would rather go to a psychiatrist to get meds instead of going through the whole process of weekly therapy sessions.
What are the learned beliefs regarding client-therapist relationship, and can the relationship continue outside the therapy once the therapy process is over?
This is a very interesting question. I've heard about it before in the videos that you've shot, and it made me ask some of my colleagues this question to get their answer. So personally, I would not be able to become friends with a client after therapy ends, but that is my personal belief. But when I did ask my colleagues, they had diverse responses. Some of them said yes. Some of them said depending on the case. Some of them said no. So it truly depends on the approach that the person, the psychologist, is using at the moment. So the learned beliefs from the perspective of the client is that a psychologist is there to help you and give you quick solutions. And this is something that we always have to correct during the first few sessions. And sometimes the line between friendship and psychologist gets blurred. A lot of clients start seeing us as friends, and then we have to correct this idea, correct this perspective that we are there for them in a professional manner and not in a friendship manner.
What are the general guidelines that you are taught in school regarding client-therapist relationship?
Most of my professors and most of my 5-year course in university was based on psychoanalysis. So a lot of my professors are psychoanalysts, and most of them were taught in France. And in France, they still had the psychoanalysis system back then. So when they came to teach in our universities, they started teaching us based on the psychoanalytic way. So we were very, very old school in our rules and codes. A lot of our professors made us believe in the rules that our clients, or our patients as they refer to them, need to know nothing about our personal life. Some of them go even as far as removing their wedding bands when they come in contact with the patient or a client. So these are the rules that we learned. They were very, very, very based in psychoanalysis. But once we graduated, a lot of clinical psychologists started finding their own approaches, their own paths, and this started changing a little bit. It truly depends on the psychologist you're talking to and which approach they are using in the moment.
And in case of psychotherapeutic abuse, let's say that the therapist crossed the line. I'm talking maybe here about being in the romantic relationship with a client, where the client can turn to, or where can you report the psychotherapist? Is there any organization or not?
So unfortunately, there isn't. This is where it gets blurry in our country. There is no rules regarding that exactly. So there is no board of psychologists. There is no foundation that is responsible over when somebody gets their license revoked or when there is a case like this. So this is very unfortunate. Sometimes when something like this happened, a lot of psychologists get together and they start or trying to fix the issue with the psychologists without bringing any authority, since there is no authority that overlooks these kind of issues. So unfortunately, there isn't foundation or a board of psychologists to overlook these problems.
But you have a law, yeah, for psychology, but not a board of psychologists or association.
The law is mostly about the practice of psychology, that only people that got their degree from a specific university and completed their work and got what we call agrément, which is an approval of the Minister of Health, can practice psychology in their own private practices. This is the law regarding psychology, but nothing regarding the client and therapist or the patient and clinical psychologist code of ethics.
Is supervision a must for a therapist in your country?
So it is definitely a must between psychologists, but it isn't a must in any rules or any law or any code of ethics. But it is something that we encourage everyone to do. Our professors encourage us to do right after graduating. So it is definitely a must for a lot. And supervision is usually something that you can do for a very long time. It isn't specified by period of time. It isn't 2 years only. You can do it for like 5 years, for 10 years. You can meet with your supervisor alone, individual sessions, or even in a group setting.
Okay, the seventh question. What are the most common complaints that the client comes to therapy for?
So as I've mentioned before, it's always related to the family. There is always a lot of issues regarding parenting styles, regarding the childhood of the client. So I'm pretty sure that this is something common in a lot of nations and a lot of countries, but it's always related to the parents. And when we dig deeper, the main disorders or the main conditions that always reoccur are definitely depressive episode or anxiety disorders, definitely OCD, and a lot of personality disorders in the cluster B category. So these are the most common conditions that we see and that my colleagues see as well in the field.
And can you maybe connect these emotions to emotions that you mentioned, anger and sadness? Maybe are they connected to some collective trauma? What is the collective trauma? How are people reacting to this trauma?
So this is very nice since we always talk about intergenerational trauma in our country. Since I've mentioned before, we were colonized, there were a very long period of terrorism. So all of this affected the parents of our clients. And it's a very big cycle of abuse, of emotional abuse that we always point out to the client. And whenever we do awareness on social media, we post videos about it, we talk about it, we write articles about it, we always mention the point of intergenerational trauma. Since we have lived in a war for a very long time and then during terrorism for a very long time and the economy crashed, all of this really affected the parenting styles of our clients' parents and their parents and so on. So I'm pretty sure this is why I've mentioned anger and sadness before, since these are the issues that we see a lot in our clients, especially today and especially with anger.
Can you tell me more? How did it affect it? What kind of effects do you see in these parenting styles?
I could bring an example of this. During the war, a lot of the parents, a lot of the kids were not allowed to show grief. We're not allowed to cry. We're not allowed to show or what they call weaknesses, since they were in a very survival era. They had to survive, so they had no time to show weaknesses. They had no time to show emotions. And it was something that was frowned upon. So whenever these parents, when the war ended and they started parenting their own kids, whenever the kids showed any particular emotion, it was frowned upon. I could give you an example of that. A lot of the parents and the parents of the parents, whenever a little boy cries, they would tell him, "Don't cry, you're a man." So this is where the traditional roles come in view. And this has affected a lot of the parenting styles. A lot of the men we see in therapy, they repress their emotions because it's very bad to them to show emotions. And this comes from their parents and their parents. And it always goes back to the fact that during the war, during terrorism, during the survival era, they were not allowed to show emotions. And it went on and on and on. And repressed emotions led to anger.
Can you tell me more about this terrorism era?
So the terrorism era was in the 90s and it ended around 2002. Very much it ended in the year 2000, but 2002, it's where everything ended for sure. And it was very common in the big cities and the big areas. A lot of women were terrorized during that time. So the main target was everyone, but a lot of women were very much targeted during that time. A lot of young women that were studying, they were in university, a lot of places were bombed, a lot of people were beheaded in the street. So this has created so much conflict during this day, time and age, since it's only been 20 years or 25 years since all of this happened. Currently, like in the capital where I live, there are specific areas that are very poor and they have a very high level of drug abuse and drug addicts and drug dealing, because during these areas, during the terrorism time, that's where the terrorists were doing their activities the most. So this is an overview or an example of how that time period has affected us today. So usually in these areas that I've mentioned, psychotherapy is not accepted or welcomed at all. But There are other areas where they were not affected by terrorism as much, and psychotherapy is accepted there more.
If you would share one tool, belief, or approach that is a must-have for you as a therapist, what would that be?
This is interesting, and it's something that not everybody would agree with me on. And it's something that I believe beyond just therapy, beyond just a psychologist. I believe that family doesn't need to start with the family that raised you or the family that you got to know during your first years. That family doesn't start in blood. It doesn't have to end in blood. You can find different families throughout your life. Your friends can be your family. Your partner can become your family. The people you were raised with, your parents, don't necessarily have to stay in your life because of everything that they have done to you. So that is something that I truly believe in, that family can be found in everyone and everywhere.